welcome the panel. Research and awareness are the two glowing eyes of advancement of any science. Unfortunately, when it comes to mental health sciences in India especially, I believe they doze. And in the recent times, if at all they have opened in India, especially in the field of de-addiction medicine, then it has been because of the excellent efforts that two of our panelists have put in. Dr. Pratima Murthy from AIIMS, she's the director and she was the head of the de-addiction center that she herself started. And Dr. Atul Ambekar from All India Institute of Medical Sciences. Apart from receiving multitudes of awards and honors, they have published innumerable articles in scientific journals which keep guiding us, not only in India, but I'm sure abroad, about the de-addiction work that they envisage and they have thought of. If these were the two eyes of creativity, then we have Dr. Menon with us, who has been on the panel he's a retired IRS officer and he's currently consultant to the United Nations Office of Drugs and Crime. So we have a third eye of Shiva who destroys the evil and two eyes of creativity. And so we have a panel full of expertise. So let's get the ball rolling. I welcome Dr. Murthy and Dr. Menon. Can we just have your videos on? Yeah. Okay. So, mental health is something that we have about 140 crore opinions on in India. I would just like to contextualize mental health for the sake of audience that I am a cricket buff, like most of the Indians are. And I always give this simile to cricket and mental health. So if you are at Wankhede Stadium and there is a cricket match that you bought a ticket for, and you go to the stadium and it has rained, and the pitch is absolutely wet, you know that the match can't happen. The other area of the ground which probably decides whether the game will happen or not is the bowling run-up area. And of course there are fielders all around. So I always believe that the pitch is like the IQ for the brain and the bowling run-up is like the emotional quotient for the brain. And there are then other areas which you can see on visual inspection sitting in the stands. And whatever you see is something like what you see in neurology. So you can see on the CT scan, MRI, you would see that there is a damage and you can sympathize. But below the surface of the lawns, if there is moisture and the playing condition as decided by the organizers is not conducive for fielding, the match still won't happen. And all the mental health, problems are probably associated with the moisture which you cannot see from the surface. But there certainly is a moisture. And for a long time in de-addiction, we did not know where this moisture was. Now we know that if you put a skewer right in front of my eye and ear, where those skewers are likely to meet, that's the area. We call it the ventral tegmental area of nucleus accumbens, and that is what pancreas are for diabetes. So that is the area which responds differently and creates the problems. So those substances or experiences which can directly affect that area, which is right in my brain, and it is as physical as pancreas, and it shows as chemical changes as truly seen in pancreas, but of a different kind. We call it superstimulant effect. And what are the substances that can cause, or experiences that can cause these superstimulant effects? Well, there are multiple. There are CNS depressants, there could be stimulants, there could be cannabis, and there could be designer drugs, hallucinogens, so on and so forth. In fact, even nicotine, inhalants, and caffeine, tea, all these things can cause some kind of disturbance there. And of course, in the pandemic, we have seen that the internet use increased tremendously and the kids were, just stuck on the internet for the want of any of the recreational facilities or socializing opportunities. And all this we now believe is creating some kind of a post-corona pandemic affection of the youth, how they see the world, how they interact with the world, and how they behave. So my question to Dr. Menon is that, how big is the problem in India? And what are the trends that you see, and what are the concerns that you believe should all of us be hanging on to?
See, if you see the data released by NCB, Narcotics Control Bureau, and the DRI, Directorate of Revenue Intelligence, you will find that during the last 5 years, the supply of drugs into India has been maximum. In fact, many people were under the impression that the COVID pandemic would have reduced the onslaught of drugs into the country. But it has actually shot up like anything. If you see, last year, 2021, we had 4 major seizures of heroin. I'm not counting the Mundra port seizure. Without counting that, we had seized around 820 kgs, totally valued at 7,000 crores, just in 1 year. And Mundra seizure, all of you would be knowing, the biggest seizure in the world, 21,000 crores, just imagine. Even many state governments would not be having that kind of a budget. So there is somebody who is some godfather who is phenomenally rich, who is controlling either within the country or from outside the country. So 2022 you take, we have hardly crossed 5 months. As per the seizure figures, we have crossed 820 kgs. I told you 820 kgs was the seizure which was made last year. In this 5 months, January to May, we have crossed that figure of 820 crores. And last week, all of you would have read the newspapers and the TV would have seen, in Cochin, the Indian Coast Guard and the Directorate of Revenue Intelligence, they seized from Lakshadweep a consignment which was valued at 1,500 crores. Just imagine one consignment, 1,500 crores. So we have an enormous consumption in India. Otherwise, nobody would be pumping in so much of drugs into the country.
Yeah.
Of course, we can say that all of you know that we are also a transit country. But I mean, there is a very sizable amount of consumption in all our education hubs. We cannot deny that.
Yeah, Doctor.
This is what I would like to say as my opening remarks.
Yeah, I do agree the huge amount is coming in, and obviously there is a demand, and that's the reason why it is coming in. And one of the articles that Dr. Ambekar, who is on the panel, had written, it said that there are about 450 million nicotine users. Okay, let's talk about illicit drugs. Let's keep the illicit away right now. So 450 million nicotine users, 160 million alcohol users, and maybe about 80, 90 million other users in our country. But what is problematic is that the age of first use is dropping down, and number of people who are estimated dependence users is increasing tremendously. I would like to ask Dr. Murthy that there is this usual argument that if somebody wishes to consume addictive substances or experiences hazardously, then it's their funeral. And why, as a responsible citizen, do you believe we should be concerned about the substance use in the country?
Yeah, thanks, Ashish. I think initially there's a lot of stigma associated with the use of substances, so much so that, this user is also construed as much of a problem as the drug. So I think it's very, very important to understand. And I think over time, we know that there are several reasons why people turn to drugs. You were describing it in the form of a cricket match and the cricket field. But let me tell you, let me give people who don't follow cricket an analogy of the soil and a tree growing in that soil. So in the soil, you have all the negatives that can perpetuate the use of substances. I mean, what Dr. Menon mentioned in terms of availability, affordability, easy access is one very important thing. The second thing, you mentioned younger people using substances. Obviously, one aspect might be a recreational and curiosity, but now we know that the use of substances has become a way of dealing with a lot of negative emotional states. So that is why I think it's very important to change the perception of young people who use drugs rather than consider them as problematic, is really to understand why is it that they're using these substances? What is it doing for them? What are the things that are missing in society which make people turn to the use of substances? You mentioned legal and illicit drugs. Now, I think that's all in our minds because, we know that drugs like nicotine, which is the smoking of tobacco or the use of smokeless tobacco, or indeed the use of alcohol, is as problematic perhaps as the use of illicit drugs. And secondly, we also know, while Dr. Menon spoke about heroin, we also know that there is an increasing use of pharmaceutical drug use. So there are a lot of people who use painkillers, who use benzodiazepines, etc., as ways of dealing with their minds, dealing with their stress. So it's a whole lot of things. And I think it's like peeling an onion. Some people are at risk for developing addiction. We know that, for example, addiction runs in families. There might be a genetic risk. But at the same time, we also know that young people with difficult temperaments, people who can't, control their attention, who are very restless, young people who are very anxious, have mood disturbances, when all these things combine, and when there is availability of drugs, when there is very little other activity to do, when there is a lack of social support, when there is stress, all of it kind of, and you have a peer group which uses drugs, all of it kind of combines to produce the whole problem. And one of the things we also remember is that we shouldn't be looking only at addiction. Addiction is the tip of the iceberg. For every person who has an addiction, there are a lot of people who are using substances in a harmful or hazardous manner. So I think it's important to really understand that there is a large spectrum of problems. But what you said in the beginning, that the younger people are using substances, this is a matter of great concern. And we know that over time, over the last few decades, very, very young people have started to use substances. So,
yeah, Dr. Murthy, we talked about the individual happenings and whatever that happens to an addict and dropping ages. But how is it really associated with criminality? Does it impact the production, the industrial production? Does it impact?
When you look at the users that we see, they are not involved in criminal activity. They are not involved in any other kind of thing. They are young, otherwise wonderful people, for whatever reasons, have kind of turned to substance use. So I think it would be a great injustice to people with substance use to kind of immediately associate substances with criminality. I'm sure there is a group of people who might get there when they are desperate for money, when they, they exchange, when they desperately need drugs. But that's only the tip of the iceberg. For every person like that, there are at least 20 or 30 people who have no involvement in any kind of criminal activity, but are harming themselves, their families, through the use of substances. So I think it's very important to recognize that these are in some ways victims of substance use rather than perpetrators of any kind of problem.
Yeah. In fact, most of the violence that happens under the influence of substances is domestic violence. It's the poor wife or the partner or the children who get hit by the person who suffers from the disease. And we know for sure that Bombay police had conducted one survey which said that 80% of petty crimes happen in combination with substance use. But those are petty crimes, not serious injuries or anything. There are unique incidences, but sometimes what happens is that too much focus on those incidences probably criminalizes each and every addict, which is very unfortunate because it hurts the treatment program for the addicts and alcoholics. And of course, we can't forget the accidents, especially in youth. Car accidents, vehicular accidents.
And remember, car accidents, vehicular accidents don't occur so much with people with addiction, rather than young people who are driving under influence without wearing a helmet, and not able. So I think a lot of it is really to understand the kind of hazards that can be associated with the use of substances, and for people to recognize that these are chemicals which take control over their mind and body, and though they are transitorily relieving people of their distress, that in the long run they become problematic. And therefore it's important for people to understand other ways of being able to have recreation or relief.
Yeah. Dr. Ambekar, well, these addictive substances kill about 1.2 crore people every year, alcohol and nicotine being the major killers. How do these pleasure chemicals or experiences affect our health? And if they are affecting our health, and as Madam said that they have social consequences, why isn't a person able to correct his or her course?
Right. So, thank you for this question. In fact, what we need to understand first is what we call as substance use is not really a modern phenomena. Human beings have been altering their mental states by using one or the other psychoactive substance for literally thousands of years. The history of psychoactive substance use is as old as history of mankind itself. But just like all other facets, all other aspects of our life have changed, the pattern of substance use has also changed. Now we have substances which are much more potent, much more harmful, and hence much more addictive in nature. And this possibly leads to much more severe degree of health consequences. So as you rightly point out, that there is a very high degree of morbidity and mortality associated with substance use. This morbidity and mortality, as Dr. Murthy also rightly pointed out, is not associated just with people with addiction. Even there are a large proportion of people who may not yet be progressed to the level of developing full-fledged addiction, but they are still using it in harmful and hazardous manner. And even occasional users may sometimes be using it in a pattern which in a particular given instance or episode may happen to be harmful for them. For instance, driving under intoxication and accidents, or overdose and death. So these are various ways in which substances can cause a morbidity and mortality, including the direct toxic effect of substances itself and the effects indirectly which occur because they have developed addiction on these substances. So people developing addiction on these substances, hence not able to look after their health and hence succumbing to other health problems. That's one of the mechanisms. And then there is direct toxic effect of these substances. Now here there is a very clear distinction between the toxicity of substances versus their propensity to cause addiction. The legal substances like alcohol and tobacco are perhaps most toxic of all the substances. When the scientists have actually graded substances as per the harms, propensity to cause harms, alcohol and tobacco came out on the top, and cannabis came down further way down on that list in terms of direct toxicity. So what we need to also understand is legality of a substance does not confer any protection to it. So it is not really an indication that if substance is legal, that means it's safe. I'm doing something safe for my health. So all psychoactive substances can be associated with harmful health consequences. And that's something which all of us need to bear in mind. And one should never forget what Dr. Murthy said, and I must highlight it once again, that people suffering from substance use, they are not perpetrators. They are actually victims. They are suffering from a chronic non-communicable disease, and they should be treated as such.
Yeah, but sir, why are they not able to course correct?
Right.
दूध से गला छाछ भी फूक फूक के पीता है ऐसा हम लोग कहते हैं.
Right,
So
absolutely.
why are they not able to course correct?
Right, right. And the answer of it lies in in partly what both you and Dr. Murthy told us earlier, the ventral tegmental area. Basically, the area of brain known as brain reward system, which is responsible for giving us pleasure. And Dr. Murthy used a very nice expression that they sort of hijack these psychoactive substances in a way, start controlling our brain reward system, so that apart from using that particular substance, nothing else feels pleasurable. The using that substance becomes number one priority in life. And that's why even if people want to quit, they are unable to quit. And that's what the disease of addiction is. Right? People always have this kind of misconception. Oh, if you have a strong determination and willpower, why can't you just quit it? Well, it's like just by having a strong determination and willpower, you cannot come out of depression. You cannot lower your blood pressure just by strong willpower and determination. You cannot normalize your blood sugar if you are suffering from diabetes just by willpower and determination. This is a disorder. It requires proper management, which requires lifestyle changes, psychosocial interventions, pharmaceutical treatment, and so on. The same holds true for substance use disorders as well. Even if people want to, they will not be able to control it. Loss of control is the cardinal feature of developing substance use disorders. And that's what that should be one of the important take-home messages for all of us today.
Ashish, may I just add to what Atul has already said? I think those are very, very important points that Atul has made. And that is, a lot of people think that they can control the use of their substances and they can quit when they want and they can stop when they want. But the problem is, and there's a very nice saying in English saying, first the man takes a drink, then the drink takes a drink. Because what happens is when there are biological changes, and these are all chemicals, so they produce certain biological changes, there is what is called neuroadaptability that occurs. So what was actually providing a buzz or some relief in the beginning stops providing that relief. And therefore, the person tends to have to use more of the substance to get that relief. Loss of control is something that Atul already mentioned. And then what happens is once a person develops a regular use of the substance, when the person doesn't take the substance, the person develops what are called withdrawal symptoms. Now, to deal with the withdrawal symptoms, the only thing that the person knows is to use the substance again because it temporarily reduces the withdrawal. And that starts the whole pattern of continuously using the substance. And then the person simply does not have the control because the brain has taken over that control. And that's why it's very important to try and stop, not to use substances, of course, but to try and stop substances before this pattern sets in. So, typically if I can just finish. So one of the things is, for example, and yesterday I was just quoting this example, when a person goes to a party and has 6 or 8 drinks and can hold his drinks, people think he's the hero of the party. But actually, this person does not have perhaps the biological responses or sensitivities which warn him that the person should not be drinking further. So many people have these signals which tell them that, they're tottering, they're not very steady on their feet, they should stop. People with a propensity to addiction don't have these warning signals. And that is why they must be extremely careful. And it's very difficult to determine who's at risk and who's not at risk. That's another problem that we have.
Yeah. I always say that I ask this question to my patients or relatives or audiences that if you are eating sugar, do you eat sugar because one day you want to be a diabetic? Okay, obviously the answer is no. And I always tell all my audiences that no person who consumes a psychoactive drug or addictive substance or experience wishes himself to become an addict or an alcoholic later in his or her eyes. All these pleasure chemicals that Dr. Ambekar and Dr. Murthy were talking about, these pleasure chemicals have a very peculiar relationship with the specific area that we all have been mentioning, which is the area where some different kind of reaction happens. So these pleasure chemicals keep on increasing a particular chemical called glutamate, and we call it glutamate facilitation. But I give this example of pav bhaji. Suppose I'm coming over to you at for dinner, and suddenly I announce that 5 more people are coming. You'll have to increase the pav bhaji. So you have to add the potatoes, but for 2 kilo potatoes, you won't add 2 kilos of salt, right? So 2 kilos potatoes are the pleasure chemicals, and maybe 1 or 2 teaspoons of salt is the glutamate. And that's the relationship that they have. The only difference being that once the experience gets over and the blood levels of these drugs start dropping down, the potatoes do come down, but salt doesn't. Salt keeps on increasing with every exposure. And one fine movement, the brain becomes salty. And once it becomes salty, it demands the dopamine or the pleasure chemicals. And that's where the craving comes in and the person starts losing his control. And that's when the person becomes helpless. And then he says that the first drink you have, the next drink is taken by the next drink itself. So that's how the person becomes helpless, and he's just not in the right way of thought, feeling, and behavior in order to control, as Dr. Ambekar said, that his thought, feeling, and behavior is completely hijacked. And he knows what he shouldn't be doing, but still he becomes helpless. So I would like to ask Dr. Menon that, for all these things, you could have genetic vulnerability, but if you don't have the exposure, then you would never know that you have the genetic vulnerability. For instance, if there is a man from Alaska and he is let's say allergic to groundnuts, okay, he wouldn't know for Adams that he shouldn't be eating groundnuts because they never have groundnuts in their food. My question to you is that. Why is government not making policies, or if they are making, of course they are making, what are the policies that government is making to make it difficult for people to access these drugs? Dr. Menon?
Dr. Ashish, it is not as though the government is not making policies. We have sufficient policies in India, both at the state government level and at the central government level. The problem is we don't have trained manpower to supervise, monitor, and control these things. For example, I'll give you a very simple example. Now, I was working in the customs department, and we used to make a lot of seizures, as you all know. Now, I have seen with my own eyes customs officers handling methamphetamine with their bare hands. All of you are doctors, and you know the implication of what I am telling. Enforcement officials, even police officials, they don't know, because the problem, I will tell you, when you catch a person and you find that he is carrying some white powder, all that we know is white powder, maybe that accused person will have to tell to us what he is carrying. And many a time, these are carriers and they don't know anything. They say that somebody gave it to me and I have to give it to somebody else. So how do you test this thing immediately? Now, there are some kits available, but they are not effective, as most of you know. There are officers who just handle it, and there are people who even taste it. Now, you can imagine the consequences of all these actions. So it is not as though that we have what they call a drawback in our policies. We have got sufficient policies. Our laws are very good and very effective also. But the problem is at the implementation stage, you would find that trained manpower. Now, you see, for example, I'm telling you from my experience, because as DG of National Academy of Customs, Excise and Narcotics, we used to conduct many training programs, not only for Indian officials, but also for the entire SAARC region. Now, great problem is these officers are all from ordinary disciplines, many of them from arts and humanities. And we are employing them to catch goods that are, highly, synthetic substances or chemical substances. Now, mostly they go by the declaration. Now, as you all know, we are importing, a lot of our pharmaceutical products are coming from China. Now, what do you do? The customs man at the border, what does he know? He simply sees the item, whatever is the declaration given by the importer, he goes by that. And if duty has to be levied, he levies duty. Only if there is a specific information that this consignment is not that, it contains this. only then the question of opening it, examining it, seizing it, and sending it for laboratory tests arise. So the basic problem, what I think is our manpower, whether it is in the police, customs, even NCP or other places, they are not sufficiently trained in identification of drugs, whether it is synthetic drugs or NPS or whatever it is. Their knowledge is also very poor. In fact, I ask many of them when I go for conducting many training programs, I ask them, why are you catching it? Their answer is very simple, because the government is asking us to catch it. So the other aspect that, this is very harmful for society, or the damage that it is causing to the young generation is not entering into their minds, or maybe it is beyond their duty to think about all those things. So this is one grave area which I think the government should take interest. That is, all these people have to be given a detailed training. Now, what are most of these training programs, all of you know, it's just for about 5-day training program. And in that 5-day training program, the concentration is more on the NDPS Act. And how do you seize it? How do you send it for laboratory tests and all those kind of things? The chemical damage that can cause to the human body by consumption of these kind of drugs is quite unknown to these officers. I
So,
think
sir, what is the difficulty? What is the difficulty in building capacity? So, if you say that human resources are not knowledgeable, then why is it not that the capacity building exercise is not happening?
See, capacity building, because this is one of the multifarious duties that our officers are performing. Now, you see, police department, the example of police, how many duties will they perform? So this is one among the many duties that they are doing. A customs officer, this is not his main job. He is doing one among the many. Coast Guard. So this is all these, except for what we call NCB, all the other departments are doing this job because that is one of their functions. So whereas we don't have a specialized trained manpower. In fact, we need a lot of doctors, or at least a lot of people who know about chemistry, who understands what is this drug that is coming in, what is the problem it is going to cause. And so that is not known to the average officer. So this is where the problem comes.
Dr. Deshpande, may I quickly add something here?
Yes.
Dr. Menon rightly pointed out some of the problems with our law enforcement apparatus. I think one issue which we must take note of is one concern in India is our NDPS Act criminalizes substance consumption as well. So our NDPS Act, under the NDPS Act, even the use or consumption of a psychoactive substance is a criminal act. So that's the corollary is that a lot of efforts and resources of our law enforcement apparatus, they go towards catching just simply users who are carrying with them 0.5 or half a gram of any psychoactive substance. So that's why the energies and resources are directed towards these low-hanging fruits rather than going behind the big fish or the large-scale criminals, large-scale traffickers and smugglers. So and it simply also does not follow the basic tenets of human rights as well. So in many countries now, including the UN system, there are now demands and calls for reducing the criminality of substance use in the eyes of the law. So people who are using substances should be seen as those requiring help, not should be seen as criminals engaging in a criminal act.
True, and one more thing that I have seen is that there are policies, there are age prohibitions, but in lay people, in common houses, they are ridiculed. Okay, for instance, age prohibition, many a times I have seen people commenting that you can vote at 18 and can't drink at 21. So they trivialize all these policies and prohibitions, and sometimes the media also is responsible for that. There are surreptitious advertisements which tickle the curiosity of young minds and neutralizes the complications that these substances can cause. So coming back, yes, there are so many interventions that can happen at the supply chain, but there are limitations in supply chain a modification. But Dr. Murthy, I'm sure we see that there is a rise of demand in the population, and in spite of the individual health and the social health getting affected, and mental health experts keep talking about it, there are platforms which keep talking about the ill effects. But still, why do you think that the demand is increasing, and why are the ages dropping down?
So let me just start off by connecting what Dr. Menon mentioned and subsequently what Atul mentioned and your question, especially to all the participants of this particular webinar. I think the traditional ways of trying to address substance use has either looked at supply reduction or demand reduction. Agencies like what Dr. Menon was mentioning have largely been preoccupied with reducing the supply or the availability of drugs in the market. But clearly, when considering the politics and the economics of many of these drugs, he talked about the amount of money that is generated by these drugs. So there are people who have vested in commercial interests who drive it into the market. And of course, the local demand also is a driver which encourages the use of the substances. Your question, so I think we need to look at all aspects of substance use, because otherwise it's like the blind man and the elephant. We only focus on one aspect of it and forget the other aspects of it. COVID was a very good example, which actually showed us some of the drivers of increase in substance use during the pandemic. One, for example, was isolation, was being cut off from various social support groups, access to only certain outlets for relaxation, loss of jobs, for example, loss of education. So there are many, many social determinants of substance use, which I think we need to recognize. We know that poverty is a driver. We know that early exposure to adverse childhood events can be a driver. Early exposure to domestic violence within families can be a driver. And I already mentioned the lack of social support. So I think what happens is, and anomie is something again in society. Anomie basically means that there is no sense of belongingness and engagement in society. All these at individual levels and at societal levels can be perpetrators of the use of substances. The use of substances is just an epiphenomenon of various kinds of problems that occur in society. Now, you mentioned why are people using it at a younger age? So one thing is that when the use of drugs to kind of normalize your mood, to have a good time, to hang out with peers becomes normalized in any society, the chance of people using it is that much more. Now, young people rarely have the ability to sit down and really think about the good things and the bad things about the use of drugs. For them, whatever is easily available is something that they use. And when these are available in society, and when there is a certain normality associated with these substances, younger and younger people use substances. Let me give you some more simple examples. You send a household sends a child to go and buy alcohol or drugs from the outlet nearby. So the child gets exposed to the fact that it is something that adults do, and therefore, starts to do it. So I think these are some of the reasons why possibly we are starting to see substance use at a much younger age group, because of the availability, accessibility, the kind of attitudes to the use of substances. All of it kind of, come together to cause this the use. And it's very tragic, because we see now, young kids, particularly in deprived areas, young kids as early as 8 to 10 years are using substances. Kids, I'm sure Atul has much better, first-hand experience of this. Kids 10 to 12 years are injecting drugs. And I think that is a very, very tragic travesty of the effects on society. The use of solvents. You see kids smelling petrol and getting the effects of the petrol. That's very damaging to the nervous system. So having seizures. dying suddenly. So there's a whole aspect of it. We tend to think of drug use as happening only among the educated kids, in schools, but that's not the whole picture. There is a whole range of society which is impacted by drugs. I'm sure Atul will want to.
Can we not do something? Yeah, sorry. Both of you can answer. Can we not do something at that age, so that young people take a knowledgeable choice, make a knowledgeable choice?
I'll just start off that, Atul, and let you take over. I think there's a lot that needs to be done for our young people. It's not just about not doing drugs, but really, growing up in an environment where you not only focus on academic performance, but on overall kind of developing, other interests which allow you to expend your energy, including interest in physical activities, developing other hobbies which can, excite you or, reduce the anxiety, be available to children. We call them life skills. Some of these life skills are also very, very important. How to communicate, how to deal with distress, how to have a safe, good time, how to be able to critically think about what's good for me and what should I think and ask questions about. And of course, in some countries, they just say no to drugs when you're young, and kind of bring it into young people to just say no, without worrying too much about it. So a whole lot of these things are some of the ways telling people how to look after their own mental health. And I think that's very important as well. How to regulate your mood, how to have a good time. There are young kids who are vulnerable. I mentioned, kids who have what are called externalizing symptoms, can't sit still, can't concentrate, can't focus. Kids who are very anxious by nature. Both these are kids who are very moody. All of these kids with intellectual disability, who kind of get into a peer group and can't. So a whole lot of things that we can do for young people, not only to help them to stay away from drugs, but not to get suicidal, not to get into bad company, not to watch too much pornography. I mean, a whole lot of things that need to be done for young people. Atul, I'm sure you'll want to add to that. Over to you.
Yes, Dr. Atul.
Thank you very much, ma'am. Dr. Murthy rightly pointed out about the vulnerability of young people. And what we must not lose sight of is the social determinants of health here. And in this case, social determinants of mental health. People often point out to me, I was on the railway platform yesterday. I saw a group of 10-year-old rag pickers, and they were smoking cigarettes and inhaling something. And I'm really concerned about this. I said, you are only concerned about their substance use. You are not concerned that 10-year-olds are unsupervised on railway platforms picking rags, right? So in the kind of underprivileged areas of society where you see a lot of these substance use problems, substance use is just one of their many problems. These are the bastis which don't have good drinking water, good sanitation, they don't have education, they don't have employment. So there are a host of other problems, and perhaps using substances is just one way for these kids to cope with whatever the life has to offer to them. So one thing we can do certainly for reducing substance use risk for our young people is to make the world more livable for them, right? So basic needs, survival needs, if that are taken care of our young people, that would be great. Secondly, education. Being associated with an educational institution itself is a protective factor for substance use. So very often in our discourse, we keep blaming, schools and colleges have become hubs of drug use, as if the kids will be safer outside these schools and colleges. For all these talks of schools and colleges being the addas of drug use, kids outside schools and colleges are much likely to use drugs. Even in schools and colleges, majority of students are still not using drugs. So to keeping our children in the educational institutions, in the schools itself is a very useful intervention. So indirectly speaking, a midday meal program, effective midday meal program would be a great drug prevention strategy, because that will ensure that kids are coming to school. If they remain associated with school, the risk of substance use goes down. So one is that looking at these general social and structural factors. Then, as Dr. Murthy pointed out, there are specific evidence-based interventions available which have been proven to reduce the risk of not only initiation of substance use, but other sorts of behavioral problems as well. So criminal activities, lying, deceiving, in general, interventions which are aimed at making you a good, productive citizens. And most of these interventions are skill-based interventions. Contrary to the perception that just spreading awareness and scaremongering among kids, which will help them stay away from drugs, it's actually developing them skills to cope with whatever the negative situations life has to offer, perhaps is more likely to be effective. So in general, my suggestion would be to think about the social structural interventions and specific skill-based interventions for young people, so their risk of substance use that goes down.
And if Atul, can I just come in for a moment to talk about also the other end of the spectrum? Drugs are somewhere a great equalizer. So while we talk about poverty, etc., we also know, I mean, I've had law students who've come with inhalant abuse, for example. So I think it's also important to understand that in addition to the social adversity, etc., it's also about learning to handle yourself. And I think a lot of kids, and also, how do you, use your free time? What are the activities that you can get involved in peer groups? How can you have more pro-social peer groups that, that you kind of identify with, and can have activities apart from drug use, which seems to be the most attractive peer group activity? How do you develop some of these? And that's very important. I think somewhere along the line, of course, can you strengthen and support, families as well as your other environment, so that your tendency to go to drugs doesn't become the first tendency. I think those are also very important across all sections of society.
Yeah, it's music to my ears that when both of you say that be in school is a simple strategy that can work, and there are evidence-based interventions which can prevent or decrease the possibility of the first exposure in children. So these are some things that I think the audience can take home, and they can see to it that they talk to their teachers or principals, whoever they know, and try to insist upon having some kind of a school mental health program. Talking about programs, Dr. Ambekar, I would like to ask you that we have a national action plan for the substance use issues in our country. Can you throw some light on what that national action plan is and what it entails?
Right. So basically, as Dr. Murthy earlier told us about two distinct approaches of demand reduction and supply reduction. For demand reduction activities on drugs, the nodal ministry in Government of India happens to be Ministry of Social Justice and Empowerment. And they have initiated this National Action Plan on Drug Demand Reduction, which is a very ambitious, very large scale program simultaneously being implemented in all the states of the country, with more focus on about 272 districts, which they have identified as more vulnerable districts. That's where the program is more intensive, but elsewhere, otherwise, it's supposed to be implemented everywhere in the country. And this program, Drug Demand Reduction Program, actually encompasses a host of activities. Some of these activities are more of community awareness building and in general, having a more discourse on anti-drugs kind of discourse in the communities and in educational institutions. Some of the activities are skill-based initiatives in the educational institutions, where the parents, teachers, student bodies, they are sensitized for drugs. Then some of these activities involve pro-social activities like organizing sports, other cultural events, which talk about how to stay away from drugs. But importantly, the most important element, I think, of this program is that it also gives equal emphasis on providing evidence-based treatment services to those affected by substance use disorders. And in that context, the Ministry of Social Justice and Empowerment, and separately the Health Ministry also, separates the health institutions, the health service providers in providing evidence-based treatment services in the country. But I was looking at one of the comments in the chat box, and someone had asked whether lack of availability of good de-addiction centers is also a major concern in India. And I would say certainly that gentleman has hit the nail on the head. We do not have adequate treatment provision in India. The treatment gap in the country for substance use disorders is really huge. And this has been reflected in both the National Mental Health Survey conducted by AIIMS as well as the magnitude of substance use in India conducted by AIIMS and Ministry of Social Justice and Empowerment. So a large number of people suffering from substance use disorders, even if they want to, they do not find adequate treatment services available near them. And this gives rise to the treatment demand in the country. And when there is demand, there will always be unscrupulous elements coming in to fulfill this demand. And that's why we have a lot of unauthorized people masquerading themselves as de-addiction specialists and who do not have anything to offer other than just a jail-like setting where they keep people locked up for 3 to 6 months at a stretch. These the one take-home message for all of us should be that these are not really de-addiction centers. There is nothing called a de-addiction centers which requires you to stay inside for 6 months at a stretch without any medical supervision, counseling, medications, and so on. So substance use disorders are chronic non-communicable diseases, should be treated in health settings. Our governments have started some programs and initiatives, but still they are too few and far between. We need to increase them in scale, and a massive investments are required as far as treatment of substance use disorders is required.
So, sir, we understand that the problem is massive. People who can offer treatments are very, very less. And how do you make the two ends meet? How are you going to implement the National Action Plan?
So this actually can be is not something which cannot be done. One misconception people have is that all treatment of substance use disorders or all addictions requires very high degree of sophistication in terms of qualifications of the people involved as well as the settings which are involved. That is not the case. Dr. Murthy's work, some of the work which AIIMS has done have shown that even general health services can be capacitated to look after a large chunk of people suffering from substance use disorders. So just a general hospital at the district level also, even a CHC where you have a general physicians available can be trained to identify and provide basic treatment for substance use disorders. There will be some patients who will require a consultation and treatment at higher facilities, and that can certainly be done. So out-of-box thinking is required, and which now the government has happily realizing, and some steps are being made in that direction. But as I said, they just need to be scaled up and very rapidly.
Yeah, so in substance use disorder, what we know is that if you catch the disease early, then the recovery rates are pretty high, just like cancer. If you catch the disease very late, then the recovery rates are not too high. So, and the first interface of an addict or an alcoholic with the health system may not be the mental health professional. It is most often the family physician of all pathies. So what needs to be done is that all family physicians need to be made aware of the issues of substance use disorder. The second cohort of people who know is the family and friends. So the general awareness, as you talked about National Action Plan, that there is a huge effort at awareness creation. So more people know about it, the more people will identify that there is some problem with this person and needs some kind of a treatment rather than a punitive reaction from the society. There are evidence-based treatments to enhance the person to get affiliated with the treatment agencies, and we know that they work. So some people who are just family physicians but they do want to help others, they are the ones who can probably be tapped in order to create an army of people who would be able to implement those techniques, maybe motivational enhancement or just screening and brief interventions. And I'm sure though they don't have to have a certification in mental health to implement these techniques at a primary level. So I think that is the way probably we'll have to go. So in short, we know that this disease has a genetic vulnerability. There is because of the genetic vulnerability, there is a chemical a chaos that happens in some areas of the brain differently than the social or recreational consumers. And those are the ones who get trapped. The good point is that, yes, it can be prevented or it can be controlled if the person has the right kind of treatment and right kind of information at the right time. Well, as I said, that we require a huge army of people, and it can't be just mental health professionals or sometimes even, I believe, health care workers. I believe that in United States also they're facing the same problem, and they are creating something called community coordinators for and training them in order to do some kind of a community work, so that the local resources come together and start working towards a healthy community, or a community that gives healthy surroundings to the youth. So what it means is that we require some kind of a concerted or orchestrated effort amongst the responsible citizens in each and every pockets of the communities, that they will come together and try to think about what are the local issues. You said that poverty is one. The second could be maybe child labor could be another, or just the interaction between different age groups because of school dropouts, children with different age groups interacting with each other. Each community will have a different flavor that probably leads them to early age exposure to chemical addictive substances. So just like vested interests are involved in pushing the drugs ahead, I think we need to have good people, good Samaritans coming together in order to have healthy communities. And that is where I would like to ask Dr. Menon, that in implementing these policies and programs that our government has, how do you think the local people, the common people, the lay people, how can they cooperate with the government's agencies that are trying to break the supply chain or work on the supply chain? Dr. Menon, can you hear me?
Yeah. Just I would like to supplement, first of all, what my learned co-panelists have spoken about the educational institutions. See, I was associated with many education institutions, and I even worked in some of them. And I set up the Center for Narcotics and Psychotropic Substances at Manipal University. In the course of my meeting with various education institutions and the principals, what I found was most of them are very, very reluctant to even conduct a drug awareness program. I went to one of the institutions, and the principal told me, sir, I cannot give any publicity for this, because if I give publicity, the public will think that we are having a very big drug problem. That is why we are conducting these kind of programs, and my admissions will be affected. Now, all of you, participants as well as panelists, would have you ever seen any university or college in India which has a display board in front of the campus saying that this is a drug-free campus? Have you ever wondered why they are not doing it? This is exactly the reason. They are more concerned about admissions. They are not bothered about the drug problem at all. In fact, I went to one institution, and the principal there, he opened his drawer, and I was shocked to find a whole lot of narcotic drugs inside. I said, you can be arrested for this. So he was laughing. I asked, what do you do with all this? He said, sir, every day we are catching some student or the other. We levy some 100 rupees fine and close it off. I asked him, why don't you inform the police? He said, no way. I will not allow any police into my campus because my admissions will get affected. Who will come? I'll have to close down this institution. So in fact, I wrote to the UGC, I wrote to NAC saying that please compel all these people to have a board. See, if you go to any American university, I'm not telling that America is very safe and secure. They are having the worst drug problem. But any university you go there, they have a prominent board displayed in front saying that this is a drug-free campus, and each and every person, whether he's a visitor or whether he's a student or whether he's a parent, he can know what actions will follow if somebody is found with a drug problem. Now, we don't have that in India, and our people are most reluctant to do it. In fact, many of our universities are notorious. Sir, many of our universities are notorious centers
Yeah.
They have
So do you believe,
different
sir,
kind of drugs that are available there.
sir, do you believe that the stigma is responsible for that? Obviously, if the
So it
principal
is,
feels that finding a person with drug problem is going to malign their college or university, then it's because of. So what it means is that you have to make a huge effort at destigmatizing substance use in this country.
yes, suppose the UGC mandates that every college or every university should have a board in front of their campus saying that this is a drug-free zone. See, now, if everybody follows it, there is no problem. If one
Right.
university or one college is doing it, yes, they have a problem. Many parents would be worried that they have a drug problem. Why I should send my children there? So that's
Yeah, and that is where I think organizations like Asia Society India Center can be of so much of help because their members are empowered and they have a lot of influence in various agencies in the society, and they can put in a word. And I'm sure Dr. Murthy and Dr. Ambekar and whatever little that I can do, we will be able to help you out through all kinds of societies, Indian Psychiatric Society, Indian Society for De-Addiction Medicine. Well, all the agencies that are there, we will be most happy to help the UGC in whatever capacity.
No, sir, it's a simple decision. UGC and
Right.
NAC. In fact, I wrote to NAC saying that we have made so many parameters for grading a university. Why have you not made this grading? That how many drug cases were found there, how many addicts were caught from there. Why don't you do it? Because only then the university, because they think that this is an expenditure.
Yeah.
So they avoid it. They try to avoid. They say it's their personal problem. If they are addicted, let them go and get treatment. We are not here to do that. So this is the one aspect to that issue.
Yeah, Dr. Atul,
very quickly. Yeah, very quickly. I'll come into this. That thank you, Dr. Menon, for raising this particular issue. And all of us are concerned. Many of us are parents of university and school going children. So our concerns are on both the sides. But having said that, the principal who did not inform the police despite catching their students with drugs, in my opinion, did a right thing. Involvement of police in that particular case wouldn't have helped the student at all, that particular student at all. I would have been happier if the principal had involved some psychologist, some counselor, some doctor to identify the child and perhaps give them whatever counseling, whatever help was required. But a police intervention in schools and colleges for checking for drugs should be a simply no. Personally, I would not like the idea of a police person rummaging through my teenage daughter's bag to look for possible substances there, right? So that's not the idea. That's not the kind of world we should be creating for our children, where they start fearing, where they start avoiding drugs sheer because of fear of police. They should not use drugs because drugs are not good for their health, not because police will catch them, right? Because that would mean that if police is not catching you, that means it's okay to take drugs, right? That would be the opposite corollary, and that's not what we want. And simply a board of drug-free school or drug-free college means that outside this college drugs are okay. So I don't know what we are trying to say there, because if illegal drugs are illegal everywhere in the country. So a principal saying that don't use drugs in my college means you can use them outside my college is not the message. The message is, if you are happen to be using drugs, please come forward and take help from our college health counselor or student welfare committee or whatever such mechanism exists in our college. UGC can have gradation of college on the basis of whether they have mental health support available for their students or not, as opposed to how less drug cases they have. So these are the kind of lines we need to thinking about. Provide help to people affected rather than catch them as criminals or instill fear in them.
Yeah, before we go to the questions that have been put up on the chat box, two small questions. I want quick answers. First is to Dr. Pratima Murthy. We all know that all these drugs can cause precipitate psychiatric illnesses, and many a times when they need to be treated, suddenly there is an alarm. Okay, the person who is consuming alcohol, he has been consuming nicotine, cannabis, multiple drugs. The first question he asks is, Are there any side effects? Okay, so that's it's a joke of some kind. So what is your take on the medication that is required for diseases that are psychiatric diseases that are precipitated by these chemicals?
The irony of that, I put it in a different way. People spend so much on the use of substances, but when they come to treatment, they cannot afford the treatment. And that's really the irony. I think people need to understand, there was a question about cannabis, for example. Now, cannabis in high potency, we all know, can precipitate psychosis. So I think that is really the challenge. Alcohol, for example, taken in heavy quantities and suddenly stopped, can cause what is called delirium, can produce seizures. Each of the different categories of drugs, depending on whether they're sedatives, they're stimulants, they're hypnotics, they're hallucinogens, they're solvents, can produce different kinds of physical damage as well as psychiatric damage. And therefore, I think people need to understand that's why it's not safe to self-medicate with any of these drugs for a psychological problem. Of course, somebody again asked a question. Of course, can they be therapeutic? I mean, because they're psychoactive, of course they can have some therapeutic effects. But the problem is that they also produce a lot of side effects and therefore should never be used without the proper prescription, should not be used beyond the time for which the prescription is given. There are lots of people who are prescribed maybe sleeping pills, which are very, very good for certain conditions. But if you take it continuously without adequate medical reasons, there is a chance that you can become addicted to it. And that's really what people need to understand. Both the potencies, the way the drug is used, the situations in which it is used, the route in which it is used, the potency, all of it can cause effects on people. And that is why the decisions to make about recreational use, etc., are not that straightforward. Recreational use can also have problems.
Yes.
Yeah, one thing that I would like to mention is that since cannabis have been legalized in many progressive countries, there is an argument that young friends of mine always tell me that now it is legal in the most progress country in the world. And so I think they get confused in the word legalizing and endorsing. So medical community doesn't endorse cannabis or it doesn't endorse nicotine or alcohol. It doesn't, okay? But it's legal. It's the same thing. It doesn't mean that we are endorsing any of the chemicals that are available in the market. Well, Dr. Ambekar, I have a question for you. There is something called harm reduction therapy, okay? And there are lots of my friends who are recovering addicts and alcoholics who have a very negative connotation or understanding of HRT. Can you just throw some light quick, because we are just short of time?
I understand. I'll be very quick. So harm reduction, basically more than the therapy, is name of an approach, a philosophy, a way of thinking which tells us that reducing the risk of harms of drugs is more important than reducing the drug use itself. So for instance, you find your friend drinking in a party. It would have been great if he was not drinking at all. But now that he's drinking, after the party is over, you offer them a cab ride or offer them, you sleep here tonight, you are drunk, don't drive today. That simply you have reduced the risk of him meeting with an accident. That in nutshell is the philosophical approach behind harm reduction. If people are able to reduce or quit taking drugs, great. But even if they are unable to, they still deserve to live. And they still deserve to live as productive, as safe as possible. And can we do something so that their risk of falling further ill, their risk of death minimized? That simply is the philosophy of harm reduction. So it's against the philosophy of all or none. Sometimes people have an all or none approach. Either you are totally abstinent, or even if you are using even once, that means you are still using. So harm reduction actually tries to meet people where they are and try to help them nudge forward, move forward while keeping them alive and safe. So that's what harm reduction is all about. And I think if the entire world starts thinking more positively in terms of harm reduction, the society would be much better in terms of its ability to deal with substance use.
Yeah, thank you very much, all the panelists. We are really running out of time, so we will just jump to the questions. And my first question that Mr. K.V. Thomas asked this question. I want maybe Dr. Murthy to take it. And do you think that the lack of inadequate de-addiction centers or the poor functioning of such centers come in the way of extending succor to the victims of drug use?
Yeah, so I think in some ways this has already been answered, that there is certainly a shortage of specialized services. And Dr. Atul mentioned that's why we need all health professionals to be trained in being able. Not everybody needs to go to a specialized de-addiction facility as the first step. It's very important that it's in fact, we have evidence to suggest that from when the early drug use problem occurs to when they actually go, there's almost a 12 to 14 year hiatus. So I think it's about not, once they do have a problem, not to feel stigmatized, to go and get help. We are training a lot of the general, healthcare professionals through online training, through digital training, so that they all understand, they're sensitive to it. One of the questions was also about people judging you and, being very unsympathetic towards substance users. And that's again another thing we need to change in terms of attitudes and sensitivity. So I believe that just as we provide healthcare for a lot of other medical problems, we should be able to provide such healthcare for substance use and mental health problems themselves. And we also need to routinely ask people. Now, it's only now that people in healthcare are actually asking people about their tobacco use, because there was a sense of morality around asking these questions. Now we have changed the dialogue to saying it's part of your health and lifestyle question. So just like you ask about hypertension, diabetes, you also ask about substance use. You link the substance use and the current problem. You tell the person, or you engage the person in a conversation to think about whether substance use is actually causing them more harm. And you also discuss the benefits of substance use with the individual, because nobody would use it if it didn't have benefits. And then you gently suggest to the person safe ways of getting the benefits and being able to quit the substance. So I think these are all the strategies that, would be helpful in enlarging the discussion about how to get help for substance use.
But there are so many de-addiction centers mushrooming every single day, all corners of the country. And that just tells me that there is a huge demand for those treatment facilities. Absolutely. And I think what as lay people, all of us can do is that we insist on implementation of Mental Health Care Act 2017, and maybe align all these people who want to do something, let it be aligned to the law of the land. And so we insist that we find out whether that person, before admitting any of the patients, we have find out whether it has a license, whether there are mental health professionals coming over, get the right kind of information. No treatment requires even 6 months of treatment. Voluntary treatments are the best choices. All this information, if it is available to people, and then probably these people will align, and probably the addicts who get admitted there would have a better scope of a recovery.
Ashish, I think it is helplessness that drives people to get something. And I think the only way you can actually address this helplessness is to make sure that there are legitimate services available and are affordable, and people know about these services. So I think information about where services are available should also be available to people.
Lakshmi Ganpati asked this question specifically on opioid substitution therapy. So Dr. Atul, maybe you can take it. Specific to opioid use, could you comment on availability and accessibility of opioid substitution therapy for adolescents and young adults? In several countries, there is a shift now to treating non-injection opioid dependence with medication as well. However, how many adolescents actually receive treatment in public sector in a truly confidential manner? And what are the barriers, especially when supply of OSC is itself limited, even for those who inject opioids?
Yeah, very true, very true. The lack of adequate availability of opioid substitution treatment in India is something which has been a matter of concern Both me and Pratima Murthy ma'am, we have jointly written an editorial about it 6 years ago, and then things have only marginally improved since then. So that remains an unfortunate truth that our all treatment programs, including opioid substitution treatment programs, need to scale up rapidly, and for this, governments need to invest more. That goes without saying. About the availability of it, specifically for adolescents, the guidelines of National AIDS Control Organization at least have been revised. So there was a time about a decade back when the guidelines were explicitly saying that this treatment is only for those above 18 years of age. Now that is no longer an absolute kind of criteria. Now it is based upon the clinical judgment. And as clinicians, as psychiatrists, all of us know that this form of treatment works actually very, very good for those with long-standing illness, lots of complications, poor social support, and so on. A young person, adolescent, who may have actually come into treatment with a relatively shorter duration of illness, perhaps a less severe degree of addiction, may perhaps has a shot at having the so-called acute treatment of withdrawal or detoxification, followed by either naltrexone, coupled with other psychosocial interventions, and has a shot at actually remaining a substance-free life. So that opportunity should be offered as a first choice, perhaps, to such an adolescent. But if the clinical need demands that an adolescent be treated with this treatment, then there is no reason to actually deny this treatment to an adolescent as well. At our community clinics, which we run in urban underprivileged areas in Delhi, there are some adolescents on this form of treatment as well. But in general, as a psychiatrist, as a clinician, I would not prefer as a first line treatment for an adolescent. I would look for other alternatives as well.
Yeah, Dr. Menon, there is there are two chats which are criticizing the government or the authorities. They believe that the government itself is the problem, and we take great pride in philosophy of Bhagavad Gita, which says to do our duty, but people in power do not do their duties. How far do you think this is true? Do you believe that it's really the fact in our country?
No, Dr. Ashish, that is a common man's perspective that the government is not doing enough, or the government's departments are not doing enough. I mean, those of us who have worked in the government, we know what is happening inside. Now, for example, I will tell you, the government is training almost, there are so many departments. If you see the narcotics, anti-narcotics front, there are more than 12 central government agencies. I need not narrate all the list of agencies here. Most of you know it. And state government also has another complementing team. Now, the difficulty I'll tell you is where we have, because of globalization, many of our policies have to be aligned to the international level. So I'll give you one example. Now, let us go with Mundra seashore. 21,000 crores, which I told you was the world's biggest seashore. Now, what is the problem there? Many people are very contemptuous. When you ask them, they say, oh, no, 10 consignments would have gone. Only this one consignment you people got. Maybe it is true, but they don't know what is the real problem. Containers. For example, Mundra port, if you take, I think they have handled somewhere about 40 million containers in a year. Now, can you search 40 million containers? Are you going to employ an army of officers for that purpose? Even in the United States, it will be shocking for all of you to know that only 2% of the containers are checked. Because if they say, if you open one container, there will be hundreds of mile longs of containers waiting in queue. Can you afford that? So what happens is we rely only on information. Only when there is a reliable information do we open the container. So what happens in general, we have to believe the passengers. For example, you take airport. You see the amount of gold and drugs that are coming. Now, earlier we were having 100% check. So when I joined my department, it was 100% check. And there was a huge outcry every day in the newspapers and media, and government used to be flooded with complaints that people are being harassed. So the government said, no, only 2% of the people are indulging in this sort of a crime. Why harm all the 100% for that purpose? So only if there is a reliable information, you catch the passenger. So what happens is we have to accept people's declaration, whether it is the importer or whether it is the passenger, we have to accept his declaration. So that is why we find that the percentage of detection could be less. It is not as though that the government is not, everybody is doing their level best. But the problem is government itself has brought in this restriction that you cannot harass people and it has to be selectively done only on the basis of prior information.
Very quickly, I will just come in. I think it will be unfair to criticize government officials or government departments involved in this entire effort. They are working very, very hard. What needs to be criticized is this over-reliance approach on drug law enforcement and supply control approach, right? What we need to remember is there is very limited scope for sheer brute force to be able to stop availability of drugs anywhere in the world. So supply control itself, if you over-rely on it, it is unlikely to work. There has to be a judicious balance between supply, demand, and harm reduction. As long as there is demand, people will find a way to supply, to make the supply available.
Yeah, I think it is high time that we don't ask what your country can do for you, but what you can do for your country. And I think in community coalitions, that's the magic. And, I know that there are like-minded people who earnestly want to do something for their communities, but they need to be supported, and we need to have a facilitation with the agencies of the government, with the expert communities, with the healthcare workers, with the teachers. I think Shilpa is there, Shilpa Adarkar, my colleague from KEM Hospital, she's in the audience. She has said that a lot of work has to be done with parents and teachers, which I agree, couldn't have agreed more with her. Well, I think the time has come and we need to call this beautiful evening off. But before we call it off, may I ask Dr. Menon what would be a 1-minute message for our audiences from your side?
Yeah, I will tell you the title of an article which I wrote in a magazine. No drug peddler will come to visit you in hospital or attend your funeral.
Yeah.
Okay.
Very right. Very right.
Yes. Dr. Murthy?
I just wanted to first thank the audience. I think they've been brilliant. There's been so much of, interest and, curiosity as well as suggestions that have come through. There are a lot of people in the audience who I'm sure could have easily been on the panel today because they already have a lot of experience in this area. And I think the most important thing is that one size does not fit all. As we are different, so are drugs. And what strategy works today may not work tomorrow. And therefore, a whole range of strategies which discourage the use of substances and encourage people to be happier through other means, as well as help and support for people. Again, help and support of a variety of nature, including help with detoxification, with counseling, with maintenance treatments, with harm reduction strategies. I think that is what we hope that people will get. I wanted to end on the fact that I think it's a right of people to be able to get treatment, just like for any other disorder. And I hope we will move in that direction. Thank you very much for having me. Dr.
Ambekar?
Thank you, the organizers and the wonderful audience for very interactive kind of participation. It's a panel where only we are speaking, but through the chat box, the audiences was also interacting with us. And thank you very much, audience, for this. My take-home message will be there is nothing moral or immoral about the choice of using a psychoactive substance or not, right? So, and substance use disorders are like any other chronic non-communicable diseases and should be treated as such. Thank you.
Well, thank you. Thank you very much. And well, this brings us to the end of this beautiful evening. We understand that substance use is not a folly, but it's a mishap. And it creates a lot of problems in people's lives and lives of people who are around these unfortunate beings. It is said that behind each and every addicted person, there are 15 people who are restless, confused, as disoriented as probably the addict or an alcoholic is. Yes, it's a genetic problem, and it gets precipitated because of certain situations, maybe in his life, the individual's life, or his circumstances, or the society. Many a times, the right kind of information can prevent. There are evidence-based interventions which can probably make a person think before consuming or before exposing the brain to its effects. There are agencies that are working throughout. The government agencies are putting their bit. The health experts, the institutions are putting their bit. It is high time that the community-based interventions get structurized, and they get structured into the realm of those communities. So there have to be facilitation. There has to be a facilitation within the community for fighting these problems that our youth are facing. Communities that care is a model that probably has worked in pockets, and it has a lot of potential. We are working on one of those projects, and Dr. Murthy has been advising us on that. And I'm happy to say that in the last 2 years, we have been able to go back to about 1,000 healthcare workers and train them on how to screen addictions at an early stage, and what kind of information needs to be provided. And we are looking forward to further training under the guidance of the experts all over the country. We are also looking at teachers and parents, as they belong to the world that children live in, and they play a significant role in whatever decisions that children are taking. I believe that the mental health experts are there to give their expertise, but the community can facilitate their entry into many doors which they probably cannot open. And I'm happy that Rotary has been very helpful to me. In fact, they have started a Rotary Action Group Addiction Prevention, which is a national level body since 2017. And they have selected de-addiction as one of the thrust areas. We are going ahead with the project currently with 7 municipalities, and the reception that we have got is excellent. So what I'm trying to say is that it is possible. It is not only the mental health experts that are talking about de-addiction now, but there are common people, there are industrialists, there are entrepreneurs, there are business people, there are Rotarians who are talking about de-addiction, and it is possible. So I believe on this positive note, all is not bad. We can certainly do something together. So I say cheers to community coalitions, and thank Asia Society India Center for inviting all the experts here, Dr. Menon, Dr. Pratima Murthy, Dr. Ambekar. Thank you very much for being with us, and our partners in media, whoever has tried to spread this message to people. I would certainly tell Asia Society that if they are collecting these questions, please forward them to us. If there are people who would want to volunteer in the de-addiction services in whatever little capacity, please, we certainly will be of some help if we can. Thank you very much to the audiences and wonderful responses and questions that they have asked. And good night. Shabba khair.